in size, irrespective of the type we are dealing, 1, 2, or 3. And what is the skin lesion shown on this slide, and which neuroendocrine tumor is this usually associated with? I'm not repeating the question. Question is right in front of you. So you can read and you can answer.
Click on slideshow, sir.
No, not yet. We are giving 3.5 minutes. Oh, you mean in a slideshow?
Right,
yes.
Sir.
Okay. Okay, so we move on to the second question. And the second question is again 3 parts. 50 years old male has presented with in emergency with pain abdomen. This is a CT scan. So what you have to find out is 5 salient features of this CT scan. So there are 4 frames which have been given to you. Look at them before I tell you the other 2 components of the question. So 50 years old male who has presented to the emergency with pain abdomen. So let's look at the second and third component. What are the 4 blood tests you would order to get to the underlying etiology of this diagnosis? What are the 4 blood tests you would order to get to the underlying etiology of this diagnosis? And the question number 3 is put 3 most. I've given 4 choices. You have to give 3 most common type of mesenteric ischemia in decreasing order of frequency: venous thrombosis, arterial embolism, and non-occlusive ischemia. I'll show you the CT scan one again before I move to the next question. Okay, let me go to the third question. Please concentrate on the video. Look at the video first. So this is the stomach. Okay, so the question has 4 components. What are the various forest class? And if there are subtypes, if any, you may give a one-word description of the forest class as well. What class do you think this ulcer belongs to? What treatment has been given to this patient at endoscopy? And please discuss the philosophy in 1 or 2 lines of endotherapy in forest class B, 2B bleeding ulcer. Forest 2B bleeding ulcer. I can run the video again. Okay. So question number 4, identify these 4 organisms A, B, C, and D. Write their usual common location and drug of choice. You can put either one drug, or if there are 2 drugs, you can put 2 drugs, but that's fine. Basically, identify the organism, usual site of location, and drug of their choice. Drug of choice. Sorry. Regarding COVID, please mention various vaccine strategies for COVID vaccines presently used across the globe. So you have to tell the various types of groups of vaccines which are available. Write a small note regarding precaution to avoid spread of COVID in endoscopy suite. What are the GI manifestations or association of COVID-19? Move to next question. Question number 6. In terms of medical statistics, first is if P is equal to 0.05, please specify what is the chance of the result from the study happening because of chance. P, you can read it out to yourself, but I would read it for you once. On being tested with a new drug, say APC, which being used to treat varicose bleed and reduce mortality, 5 out of 110 patients die. On the other hand, without the drug ABC, 10 out of 110 patients would die. What is the odds ratio for the new drugs to reduce the mortality? 5 out of 110 compared to without the drug 10 out of 110. And we are looking for odds ratio. In nominal distribution of data, what percentage of data is covered in 2 standard deviation? 2 standard deviation. What is the difference between analytic study and descriptive study? Just need to answer in 1 or 2 lines. We move on to the next question. I suppose in the exam, after 6 or 7 questions, you'll be given a gap of to breathe. Let there be a breather for half a minute before I proceed. Okay, let's go to the 7th question. In terms of infections transmitted during endoscopy, please mention 4 commonly transmitted organisms. So you are only required to mention 4. There may be more than 4, but you can mention any 4. Mention 3 categories of instruments in terms of risk of infection and need to disinfect them. What type of disinfection is required? This is what is known as Spalding's classification. Mention pertinent issue of infection with the duodenoscope. What is a major issue? And at least 3 possible solutions to infection transmitted through the duodenoscope. These are some of the landmarks studies related to GI and liver. Please mention the main theme of the study. A is answer study, B is accent 2 study, 3 is Panther trial, 4th is Gemini 2 trial, and 5th is target study. So these are the names for the study. You have to just say, we don't expect the name of the author, the journal, the year, just the basic theme of the study. questions today. So we've already finished 2/3. This question again has two components. So this is component A. It says that patient with GID, these are the 4 procedures which have been done. So you have to just tell us what procedures are they. You can see they're labeled as A, B, C, and D. So there are 2 components. This is the first component. Fourth picture should be the 2 components of the fourth picture. The first one should have been placed, second one should have been placed first. Second one should have been placed first. Okay, let's move on to the second component of question 9, which says write a small note about concern regarding use of beta blockers in advanced liver disease. So there are studies for and against. If you can mention in brief a concern regarding use of beta blockers in advanced liver disease. We'll move on to the question number 10. Identify these 2 graphs on high resolution manometry of the esophagus. So you have to give the diagnosis. So this is component A of question 10. So question 10B is identify the structure of this biopsy in a 50 years old patient presenting with dysphagia. This is an esophageal biopsy, and there are 4 indicators. So you find arrowheads, you find a green colored arrow. Sorry, these are arrows, black colored arrow, green colored arrow, arrowheads, and asterisks. So what does each of them represent in this biopsy? This is a 50 years old male presenting with dysphagia, biopsy from the esophagus. In relation to fatty liver disease, mention 5 drugs which can cause fatty liver disease. A liver biopsy shows 20% steatosis, no ballooning, and moderate grade inflammation. calculate the NFLD activity score for this biopsy? What is REVEAL trial dealing with? So REVEAL trial, of course, is not related to fatty liver disease. So the first two questions are related to fatty liver disease. Third question is from liver, but not with fatty liver disease. Okay, so we'll move on to the last question. Question number 12. Mention King's College indicator for poor prognosis and acute liver failure for non-acetaminophen cases. King's College indicators for non-acetaminophen cases. What additional important parameter or parameters, maybe one or two, can be used to assess the prognosis of ALF beyond King's College criteria? And what is the likely diagnosis of liver SOL in this CT scan?
Professor Goenka, you have logged in twice.
I think I logged in twice. So let me just cancel one. How do I cancel one? Okay. So any comments from participants before I answer?
Professor Goenka, please close one application.
Yeah, I'm doing. How do I close it?
One moment.
Okay. So can I again screen share? You have to give me the share option. I'm not getting the share option in this.
Can you see, sir?
Not yet. I'm not getting it. 1 second. Yeah. So is the slide seen?
Yes, sir. Just click on slideshow.
Yeah. Okay, so I'm quickly going through the same slides again with the answers. So when I asked 5 salient features of type 1 gastric carcinoid which differentiate from the other 2 types, I expected to find out that your answer is this is the most common type. This is more common in females because the other 2 are either equal in male or female, or the type 3 is more common in male. They're mostly less than 1 centimeter in size as compared to type 2 and 3. Lymph node and distant metastasis is rare. 5-year survival is 100%. Gastric pH is high and gastric mucosa is atrophic. So any of 5 of these 7 answers would be okay. If you write fasting serum gastrin level related answer, then you have to understand that fasting serum gastrin level is high also in type 2. So that will not be an appropriate answer. So appropriate answer can be any 5 out of these 7. So what's the ideal treatment for less than 1 centimeter size lesions? You know, it should be endoscopic resection. What is a skin lesion? The skin lesion is necrolytic migratory erythema and is seen with glucagonoma. So that would fetch you 100% marks. You must also realize that if there are 3 components of a question, they may not be equally important for marking. Like in this particular question, maybe the 1B answer will have fetched less marks than 1A and 1C. So the second question was about the CT scan. Let me first show you the CT scan. I have put the markers here. You can see the various markers. So there is pleural effusion, bilateral, there is ascites, there is thickening of the small bowel, there is air in the vulvi conventis, small bowel loops in the folds. And here you can see the portal vein is not taking up the contrast as compared to aorta and the IVC, and this means that this is portal vein thrombosis. So the answer will be bilateral pleural effusion, ascites, mural thickness in the small intestine, air in vulvi conventis, and portal vein thrombosis. So if you answer these 5, you get full marks. What are the 4 blood tests you would want? You would want to know the hypercoagulable state, and you answer any 4 of them, and it will be correct. Protein factor 5 Leiden, protein C, protein S, antithrombin 3, homocysteine, antiphospholipid, antibody, and APLA. Now put the 3 common type of mesenteric ischemia. So we have given 4, and the example would have arterial embolism is responsible for almost 50%. Non-occlusive ischemia is 25%, arterial thrombosis in 15%, and venous thrombosis is 10%. So we don't expect to get the percentage out of you, but you should mention arterial embolism followed by non-occlusive, followed by arterial thrombosis, and followed by venous thrombosis. So 3 of them you put in any order, correct order would be right answer. Now observe this video clip, and I would run the video clip while I'm giving the answer. So what are the various forest class? You know, the forest class can be class or grade. Some people call it clear class, some people call it grade, some people call it type, but it's predominantly class. So it can be class 1, which is 1A and 1B. This is spurting vessel, this is oozing vessel. 2A is non-bleeding visible vessel, 2B is adherent clot, 2C is central pigment spot, and 3 is clean based ulcer. So this is, to me, looks like 1B, which is oozing. But even if you answer 2A, which is non-bleeding visible vessel, it is okay with us. So the answer for the second component will be any one of them will be taken correct. 1B, which is oozing vessel, or 2A, which is non-bleeding visible vessel. What treatment has been given to this patient? So you saw that a combination therapy with injection hemostasis with gold probe you can write bipolar coagulation. Both of them are correct. So this was a combination of injection hemostasis with gold probe or bipolar coagulation. Discuss the philosophy of endotherapy in forest 2B. This should be 2B bleeding ulcer. This can be either aggressive therapy, where you remove the clot with whatever means you can, and then the base, you look at the base and do the therapy according to the stigmata which is present or the forest class which is present. The second approach can be conservative therapy, that the nature has already put a clot on the surface and don't try to do it. There is a difference of opinion. So you could have written about both the approach, aggressive approach as well as conservative approach. We are moving a full cycle. Initially it was conservative, then aggressive, and now again conservative. Some studies showing that conservative therapy is possibly better things to do. So we expect a line or two on this approach. These four organisms, I hope you all got it right. The first one is, of course, Giardia lamblia. You can write Giardia intestinalis, Giardia duodenalis. All of them are right. Of course, this is usually situated in duodenum, and any of the drugs, metronidazole, tinidazole, nitazoxanide, will be correct. The second one is Entamoeba histolytica, which is in the large intestine. The drugs which you can, any one of them would be correct. Paramomycin, diloxanide furoate, metronidazole, tinidazole, and again, nitazoxanide. The third one, I hope some of you found it to be correct. This is Clonorchis sinensis. This is a liver fluke. This is not fasciola hepatica, which looks a little different. The site could be either, you mentioned bile duct, or even liver would be all right. And praziquantel is a drug of choice. The fourth one is Strongyloides stercoralis, usually located in the small intestine, and ivermectin is a drug of choice. So this will be the answer to the question 4. Question 5 regarding COVID, we expect that, let me first answer the B and C. In a note on the management prevention of COVID and endoscopy suite, the 3 or 4 terms which we expect would be mentioned would be vaccination of healthcare workers, triaging of the patient, maintaining a distance and reducing the crowding in the endoscopy room, and use of PPE. So if some of these terms are there, then you score. What are the GI manifestations association of COVID? Nausea, vomiting, diarrhea, transaminitis, worsening of pre-existing chronic liver disease, and drug-induced hepatitis. So these are some of the answers which is expected. About the vaccine strategies, you have to mention that the vaccine can be inactivated virus, which in our country is Covaxin. It can be messenger RNA, which is Pfizer, Moderna, or Zydus. It can be vector associated with Covishield or Sputnik, and it can be protein subunit, which is Novavax. Now, we did not expect in this answer that you would write the name of the vaccine, but the platform by which vaccine is made is important. Inactivated virus, messenger RNA, vector associated vaccine, and protein subunit is the expected answer. In terms of medical statistics, I have seen in most of the OSCE exams, whether they are gastroenterology or any other specialty, there's usually one question on medical statistics. So if P is equal to 0.05, this study has a chance of 5 in 200 or 1 in 20 being wrong. That means the results are just a possibility of because of the statistical, and there may be by chance. Now, the second one is a little difficult question. My point of putting this question is that if you find a question to be difficult, just skip the question. Don't waste your time on that. Rather, you score on the other questions. Now, here there is a catch that I said that I don't need the final answer. I just want the person to understand the concept of odds ratio. The odds ratio is the control odd by treatment odd. Control odd in this case is 10 out of 110. That's mean 10 by 100. 10 will die, 100 will not die. Treatment odd is 5 by 105, which is 5 would die, 105 would not die. So odds ratio is different from risk ratio. In the risk ratio, this will be 10 by 110, and this will be 5 by 110. So this is the total number when it comes to risk ratio. In odds ratio is those who die and those who do not die makes the odd. Is nominal distribution of data, what percentage of data is covered by 2 standard deviation is 95.4%. For the 3 standard deviation will be almost 99 some percent. What's the difference between analytical study and descriptive study? Analytic study is the one which there is no comparative groups. So you are analyzing just one group, where the descriptive study, you have 2 groups to compare with. So analytical study has to have 2 comparative groups, whereas descriptive study has no groups to compare with. I repeat, analytical study has 2 groups, where descriptive study has no group to compare with. In terms of infections during endoscopy, please mention 4 commonly transmitted organisms. Any 4 of these would be correct. Pseudomonas, H. pylori, Carbapenem resistant enterobacteriaceae, variant of CJD, fruitful Jacob disease, Strongyloides. Salmonella will also be granted, though it is now not a common type of infections. But if you mention any of these four, it will be correct. Whereas Mycobacterium, Clostridium difficile, hepatitis B, C, HIV, and fungi are not known or very, very rare to be transmitted during endoscopy. So the examiner will expect any four from this list. Now the Spalding classification, you have to know for many reasons. So they divide I'm sorry for the mistake of the spelling, critical, semi-critical, and non-critical. Critical, like accessories, you require full sterilization. Semi-critical, like endoscopy, high-level disinfection. And non-critical, like cautery plate, bed, low-level disinfection is what is required. So difference between sterilization and high level is in sterilization, spores are destroyed, but in high-level disinfection, spores may not be destroyed. Now, mention the three major issue for this duodenoscope is elevator channel, and infections are transmitted during the elevator channels. And so this has been a major problem in the last 10 years. And so companies have made some modifications. Gas sterilization, manual cleaning of biofilm on the elevators, disposable cap, and more recently disposable duodenoscope have been some of the policies to overcome this problem. Now, question number 8 was about the trials. I have seen that many a time, either a question or a component of the question may be related to trials or studies, not necessarily this time. So don't blame me if there's no such question this time, but this is what is the pattern I've seen. So answer study deals with role of albumin in survival and hospitalization in chronic liver disease. Extent 2 study is infliximab in visualizing Crohn's disease. Enter trial is a step-up approach versus open necrosectomy in acute necrotizing pancreatitis. Gemini 2 trial is vedolizumab in moderate to severe Crohn's disease. And target study was to sorafenib in hepatocellular cancer. So we expected just the concept of this study, not the author's name or the journal's name or the year in which it was published. So the question number 9 has 2 components. Patient GIB, what are the 4 procedures done? The first one is TIPS. Second one is BRTO. The third one is fundal varix embolization by coils. And fourth one is splenic artery embolization. This, as I said, this picture should have come first. You can see the coils here, and the splenic artery branches are not filled any further. So this is splenic artery embolization. All of them can be done for gastric varices. And the second question is about a note regarding use of beta blockers in advanced liver disease. You are aware that since that trial which was published, that those who have advanced liver disease, those who had spontaneous bacterial peritonitis, beta blockers may harm more than they can do good. Though their contradictory data is available, and some people say that beta blocker therefore is useful only in the window period, neither too early a disease, not too late a disease, and that's a window period hypothesis. Some mention about this is expected from you. Question number 10 is high resolution nanometry. This may be asked during the practical question also, as well as an OSCE. So you should identify that the first graph is type 3, achalasia cardia, and the type 2 is, you can see that DCI is very, very high. Borderline is 5,000. This is 20,452, which is, and the repetitive such findings in the graph. So this is suggestive of hypercontractile or jack esophagus. Now this has 4 findings, and even if you answer, and all 4 may not carry the equal marks. So obviously this is a patient with eosinophilic esophagitis, and what they've tried to show, and this is a picture from Schlesinger, that these are eosinophils. This is dilated intercellular space between the cells. You can see the space is increased. This is elongated papillae, and this is lamina propria. Again, sorry for the spelling. This is lamina propria, strict indicating lamina propria. So you identify, maybe the examiner wants you to identify only 3 of them, but the answer should be correct. Now the question number 11, Mr. Singh, we'll have another 5-7 minutes.
Sure, sir.
Okay, so mention 5 drugs which can cause fatty liver disease, and you can mention any 5 of these: amiodarone, ethanol, estrogen, glucocorticoids, glycopulvine, HART, nifedipine, NSAID, tamoxifen, valproic acid. Now let me tell you that there may be more drugs, but then the commonly mentioned drugs would be in the answer in the model answer, which would be there. So don't talk about drugs which are very, very rare. Almost a huge number of drugs can cause occasionally fatty liver disease, but these are some of the common drugs. So if you're writing the answer, try to write answers which are the common drugs, because that may not match with the model answer if you write rare diseases. Liver biopsy, NFLD score, 2 plus 0 plus 2, 2 for 20% is steatosis, 0 for no ballooning, and 2 for moderate gait inflammation, makes it a score of 4. REVEAL trial was to do with high baseline HBV DNAs associated with increased risk of cirrhosis and SCC. I think it was published in 2007. Now, the last question mentioned King's College criteria and you all have to remember this, that this can be either a single criteria of prothrombin time or more than 6.7. Some books have mentioned 6.5. Any three of them out of these 5 criteria also would satisfy. Seronegative hepatitis, you can also write non-A, non-E. Age less than 10 or more than 40, duration of jaundice from onset more than 7 days, serum bilirubin of more than 16, 17.5, anything is correct. P time of more than 50 seconds or INR more than 3.5. What additional parameters? More recently, arterial pH and lactate after fluid resuscitation has been added as additional criteria. And this is a classical picture of focal nodular hyperplasia, where your contrast enhancement in the periphery and the central part is a satellite scar. Now, if somebody is given this picture, you may confuse with hemangioma, and this may be one of the stages of hemangioma where from periphery to central. I think the examiner would have planned that if somebody writes a hemangioma also, you may get some points out of it. So that was it. Best wishes to the exam going people. After, I think, 2 or 3 days, you have the exams. And with that, if there are any comments? Before we close? See, I must tell you that there may be, you will not be given the answer sheet. So there may be 1 or 2 questions where there may be a little difference opinion between various textbooks. So, so there may be a little difference. What is that 10A question? 10A question, thank you. So there may be a little bit of difference of opinion between the various questions. I think you are right that this was type 2 achalasia. I stand corrected there because there was esophageal pressurization. I think my guy picked up a wrong picture there. It doesn't matter. So that's the only question where there's some anomaly. I stand corrected. But I find that a number of people have written at the top that you find it difficult. Let me tell you that the plan was to give you a little more difficult questions, not to put a pressure on you, but to you understand that there will be difficult questions as well as easy questions. And there will be 25 questions possibly for you, out of which 16 or 17 may be not so difficult, but 7, 8 would be difficult. If there is a difficult component of a particular question, then please don't waste your time on that, because you will lose time and you cannot answer the other questions. I think I stand corrected on that type 2 achalasia. Rest is all okay. Any other comments? So the last question which has been asked is OSCE pattern now going to be successive exams? I don't know. Nobody has the answer. I don't think National Board still also knows about what is in store for the future. Nobody knows what will be the COVID status in the future. So, but I think this pattern is going to be there maybe next exam. I cannot say, and I don't want to commit anything. You may also find that the OSCE component is reduced subsequently, and the real face-to-face presentation or questions are given more importance. So I cannot say that, but just wait for some time. But I think it's good to practice because a lot of international exams are conducted in the OSCE pattern. So if there are no more comments, I would pass on to Mr. Singh, and we meet next week. And as I told you, that there will be a talk by Dr. D.N. Reddy, followed by a panel discussion between me, Nageshwar Reddy, and Dr. Naresh Bhatt. So tune in for next week, 6 p.m.